Good evening, everyone. My name's Josh Hopkins, and I'm a Digital Health Officer with the Adelaide PHN. I'll be talking to you tonight about secure messaging and the upcoming changes which will affect general practice. Could I just get someone to put into the sort of Q&A chat box a confirmation that you can all hear me? Thank you, Helena. So firstly, I'd like to acknowledge the Kaurna peoples, who are the traditional custodians of the Adelaide region. We pay tribute to their physical and spiritual connection to land, waters and community, enduring now as it has throughout time. We pay respect to them, their culture and their elders past and present. So tonight we'll be discussing some new developments in the world of secure messaging. One of these, which we will discuss in more detail, is the SA Health Secure Messaging Project. With Anne-Therese Mansell from SA Health, who will discuss this in more detail. There'll also be some information what you need to have ready to receive messages from SA Health, and I'll also discuss some things which you can implement to get the most value from your secure messaging program. If you have any questions about any things we're discussing, please put them in the chat box and we'll answer them at the end of the presentation. So for those new to secure messaging is a way for practitioners to send correspondence and patient information securely, usually from your practice software in the form of a letter template. There are a few secure messaging programs such as HealthLink, Argus, ReferralNet or Medical Objects, which will encrypt this message before it is sent and decrypt any messages that come to you. This means that if any messages are intercepted, they cannot be read. The programs also determine that it is appropriate for you to receive medical information by checking that you are a healthcare organisation and verifying that you are the correct organisation which the information has been addressed to. The whole process from a user's perspective is usually only just pressing a send button. There's a lot going on behind the scenes. So there have been some developments in the world of secure messaging lately, which should make using these programs much more useful and beneficial to the processes in your clinic. The first is that SA Health have contracted HealthLink as a secure messaging vendor and will soon be able to send messages with secure messaging. And from SA Health, we'll talk about this in a second. The other big change is that several of the more commonly used secure messaging programs are being made interoperable. This means that you will only need to have one secure messaging program and still be able to send to people with different programs. In the current arrangement, some secure messaging programs can only send messages to other people with that same program. Kind of like having a phone on the Optus network and being unable to ring someone on Telstra. This has meant that some practices have had to subscribe to several secure messaging programs or be limited in who they can send to. The Australian Digital Health Agency has been working with secure messaging vendors to make them conformant with criteria that will let messages be sent and received by all other conformant programs. They're currently still working with the vendors, but more should be made conformant over the coming months. A list of these programs is kept on the ADHA website. Hopefully soon you'll only need to have one secure messaging program to send correspondence to everyone in your contacts. The Adelaide PHN has recently sent out a survey regarding secure messaging to help support these projects by getting a better picture of how these programs are being used and the areas where we may need to find support and help practices. A big thank you to everyone who's filled this out. If you haven't and would like to resend it, please send an email to digitalhealthinfo@adelaidepHN.com.au and you can have your views shared. We're also developing a handbook and fact sheets which will soon be made available, which detail the procurement and implementation process from start to finish and give some tips on how to get the most from your secure messaging system. There'll also be some flowcharts showing secure messaging processes for all the major clinical softwares. We'll send some information out when these become available. So next, I have Anne-Therese Mansell from SA Health talk a little more in depth about their project. Thank you, Anne.
Thank you. Thank you, Josh. And so SA Health has embarked upon a project to enable the delivery of clinical handover documents between SA Health and external healthcare providers in an electronic, secure manner using secure messaging. SA Pathology and SA Medical Imaging already use some existing technologies to send out electronic reports, as you would be aware, and we'll be in the process of updating the SA Pathology solution. SA Health has partnered with the Australian Digital Health Agency to make this extension in the technology possible, and we have signed a contract with HealthLink to provide the service. It is a fairly large and complex project in terms of the types of documents that we're aiming to distribute electronically, and also that it does mean it should be a very great benefit to the health community as soon as possible is the aim. And we will be, as part of that, replacing the interim share file solution that some of you might have come across in terms of a short-term fix for some fax failures that is out there. Thank you. And so the way the SA Health Secure Messaging project is set up is the approach is to deliver it over 2 phases. The first phase is focusing on outbound communication. So they enable SA Health to distribute discharge summaries, specialist letters, pathology reports, and these kind of type of documents out to you in an electronic manner. We will be running it as a pilot to start with, but then a full statewide activation after that, covering all the different LHNs and areas within the state. And that is to prepare SA Health to use SMD, as we know that most of the GPs are kind of set up, but SA Health has not been able to do secure messaging so far when it comes to discharge summaries and specialist letters and those type of documents. Phase 2 is looking at the inbound communication, which is around electronic referrals and pathology orders. And again, the structure will be a pilot first and then a statewide activation after that, which we're very excited about as well, because that will be some great benefits to both, I think, the external healthcare providers like GPs, but also within SA Health with some great benefits. So in terms of kind of, I guess, next steps that we're doing is preparing for that, or finalising our design and developing the changes we need to enable discharge summaries and pathology reports to come out. But yeah, in preparation for that pilot. I'll hand it back to Josh.
Thank you, Anne. Sorry about that, a few technical issues. So thanks, Anne. There will be some time at the end of our presentation to go through some questions. Just a reminder, send these through the chat function. Okay, so there's a few things that you need to have in place to receive secure messaging from SA Health. If you find that you're struggling with achieving any of these things I'm discussing, please get in touch with your practice facilitator at the PHN and they'll be able to help you out. Many of these things are likely to have been sorted out when you registered for My Health Record. It's also probably worth noting that many of these are also required to do e-prescriptions. So the first is to make sure that your registered healthcare identifier details are correct. This is your HPIO and your HPII numbers. Most of you would have had this set up to access My Health Record, but if it's been a while since you've had a look at them, it's worth checking to make sure that they are still correct. Consider if there's been any changes in staff or business details since you last looked at them. For practice groups with several clinics, the main thing to double check is that you have different details for each individual clinic. If they have different Medicare site certificates, they'll need individual HI details. The next thing is to make sure that you have a NASH PKI certificate for your clinic. A NASH PKI certificate is what the secure messaging program will look for to verify that you're a healthcare organisation. Each certificate is unique and they are only given out to healthcare providers. Because they're unique, some secure messaging programs also use them to identify you. So if you're a practice group with many clinics and are sharing a NASH certificate, all of your correspondence might go to the same shared inbox. If you don't want that, you'll need to get a separate NASH certificate for each physical location. Luckily, it's a pretty straightforward process using your HPOS login, where you can request one. Once again, if you're having any trouble, let the PHN know and we can work through these issues with you. The next thing to make sure is that the secure messaging program you want to use is configured. If you're already using it with no problems, it means that this is already done. But if you have a license for a program and don't readily use it, you might need to contact the vendor to make sure that it's all set up and ready. Lastly, keep your clinical information software and your secure messaging software updated. The required changes to your software will usually come as part of a routine update. If you're having trouble with any of these, feel free to give us a ring at the Adelaide PHN and we'll do our best to sort it out. Next, we'll talk about a few things that might help people who already have a secure messaging system get more from their system. These are just some things to consider. Not all of them will be suitable for your practice, but hopefully some are. The practices that get the most from secure messaging systems implement them as a new process and not just as a new bit of software. This is done by looking at the their sending process they have currently. This is done by looking at the sending process they have currently and seeing how it could be improved by using secure messaging. In most cases, this takes the form of replacing the printing, scanning, and faxing processes with sending correspondence from the practice management software by pressing a send button. This also saves time following up on multiple paged faxes that don't come all the way through. Hopefully the outcomes of the current projects will mean that interested practices won't have to maintain multiple processes for sending and receiving messages, like some do now. It's usually a good idea to have clear responsibilities around how incoming messages are checked. Specify who is responsible to look at messages, how often, and how the practitioners are notified of new messages addressed to them. It's a good idea to keep track of how many messages you send by post and fax each month against those you send by secure messaging. This way you can see if you're moving in the direction your practice wants. You might also want to consider replying to letters and faxes that you receive with a short message detailing your preference for secure messaging. If you add your secure messaging details to your website, letterheads, and email signatures, it can help encourage your contacts to send by this method. So some secure messaging programs have limits on the sizes of files that they can send. Even if yours doesn't, if you send lots of large files, you'll take up storage space and it might slow down your system. Images such as logos and other brandings are often the cause of these large files. If you have a recent version of Word, you can reduce their impact by using the compress pictures function, which is shown on this slide. This will make the file smaller without affecting the picture quality. If you find that you have templates over 2 megabytes, feel free to give me a call and we can go over some of these processes which should reduce the size. We'll also be releasing a fact sheet soon which will detail this process and several others that should be able to help you. So, what does the next 12 months look like? As we've discussed, SA Health will begin a pilot and invite interested practices to join. Once the results of the pilot are considered, a further rollout will be undertaken. PHN are happy to help with any practices who need a hand setting up for this. You'll get ongoing updates in regards to this project and timelines, and a similar process will be undertaken for phase 2. In regards to interoperability, the ADHA is continuing to work with vendors. It is likely that a future update will incorporate these changes, but nothing is confirmed at the moment. You can keep yourself updated on the interoperability project by keeping an eye on the ADHA website. PHN will also send out relevant information on both projects in our regular newsletters and email. So that brings an end to the formal part of our presentation. We've discussed interoperability, reducing the number of secure messaging programs that you need to subscribe to, and the SA Health project to send information using secure messaging. We've also gone through what needs to be done for you to be ready for this change, and some things you can consider to get the most out of your secure messaging system. Thank you for watching tonight. Anne and myself will now go through some of the questions collected this evening and answer. There's no questions in our inbox. Does anyone have a question? Okay. So the first one is, hi, is there a timeline for the pilot?
We are, yes, we're working through at the moment, finalising that timeline. So as we get the plans more solidified, we'll come out and publish a formal timeline.
Excellent. Thank you. Will small practices be good for the pilot?
And they could be. What we're looking at to make sure, like we're aiming to run the pilot for around 2 to 3 weeks. So we need to make sure that the practice is likely to have some discharge summaries and pathology reports coming out in that time frame. But if you're interested, we will want to hear about it. So let us know, and we definitely won't rule anyone out.
That sounds good. We'll wait a few more seconds to see if any other questions come up. But if you have any in the future, feel free to give myself, Josh Hopkins, at the Adelaide PHN a call, 8219 5900, or send any queries or issues through to digitalhealthinfo@adelaidepHN.com.au. So if there's no more questions, I don't know, that's 6. Sorry, I found another chat box. When is the pilot starting? I'm already receiving secure messages through the public hospitals. I receive them via email, then print them off. Is there an easier way?
So once the secure message project is implemented, and it will, and if you have a secure secure message vendor engaged, then yes, there will be an easier way where we can deliver those over secure messaging. And the nature of most of the clinical information systems is it will then pick them up automatically and import them into your inbox.
So there'll usually be an inbox in most of your clinical information systems,
yeah,
which even if you've got multiple things, these messages will be collected in.
Which means you shouldn't have to print them off.
So the next question is, while the pilot is running, we will continue to receive letters via share file?
Yeah, so if for any practices that is not part of the pilot, you will continue receiving your communication from SA Health as per your current preferences and setup. And even after the pilot, if you prefer to not receive it by secure messaging, you will continue to receive it by your preference of either fax or post. We are aiming to eventually replace ShareFile, as that was always meant to be an interim solution. But we don't have an end date for actual decommissioning at this point.
That's good. So the next question, are we able to get a link to this webinar with all the Q's and A's for staff? Yep, we have recorded this webinar and it'll be put on our website. We'll email it out one day this week. Next question, how would I organise a vendor to have these downloaded directly into our medical software system? The best way is to have a talk to probably your clinical information system vendor, and have them, that would become part of the configuration which I was discussing earlier. So it might sound like you've got to get a bit more configuration to happen. So it's hard to say when the two programs interact, if it's the clinical information system or if it's a secure messaging system. So I would start with one and see if the other one helps. But if you've got any issues, give us a call specifically, and we can go over it over the phone and work out that specific issue offline. Next question. We currently use HealthLink to send clinical information to other practices. This is cumbersome in that we need to look up their HealthLink ID separately on the HealthLink website and enter it into our clinical software. The first time we communicate with them, will this become an automatic function of interoperability? I might have to take that one on notice and get back to you, because each of the programs and each of the practice information systems operates slightly differently. So when you combine the both, it's innumerable computations for that. Once again, give me a ring and we can go over that separately, but I might take that on notice and find the answer and send it out to everyone as a complete answer. Will all the doctors in the practice need Prota? So all the doctors should have an HPI generally through Proton. So yes, it's desirable. Functionality-wise, do you know if there's an effect on that?
I will take it on notice and we'll confirm.
That's another one. We'll both take on notice to confirm if that's mandatory. Will all secure messaging providers be compatible with HealthLink? We currently use medical objects for sending. So currently, we have to check on with the ADHA to see if they have become conformant, which if they have, they will, by definition, means that they should go between each other. I believe that both groups are exploring it as an option, but nothing's confirmed yet of who has actually got to the end of being able to be interoperable with each other.
Yeah.
So that's all the questions we currently have. We might wait a few more seconds to see if any others come up.
Expression of interest.
How can practices express interest for the pilot? I think you're happy for them to send it to us? Yep, you can send something to the Adelaide PHN, so digitalhealthinfo at adelaidphn.com.au, and we'll collate them and provide them to SA Health and coordinate with them to see if we can get you included. We use HealthLink to send out correspondence. Most of the clinics who have HealthLink still don't know how to download. Not sure how the pilot will be helpful if only limited correspondence can be sent. So we'll be going around as part of this project doing more educational materials and more educational sessions about how to better use the systems, and that's something we will cover in that. Can we use secure messaging to email a patient? Unlikely, because for secure messaging to work, you remember I discussed the NASH certificate. The secure messaging programs check that both the person sending it and the person receiving it have a NASH certificate. And NASH certificates are only given to healthcare professionals. So it's unlikely using these particular secure messaging products that that's possible. Secure messaging is not something that's owned by the health industry. It's used across a lot of other industries. But for the SMD programs we've been discussing, that is unlikely. Okay, so that looks like the end of the questions for this evening. As I said earlier, if you've got any questions, oh no, one more popped in. So given the last question, what's the best way to send patient an email?
I don't know.
Depends on the email program you're using, because there's good and there's bad. They all have a certain level of encryption and decryption happening. It would be best to look at that maybe separately, or to look specifically at your, yeah, it's hard to say when it's a bit broad like that, not knowing what other systems you're using. It might be best to talk to your IT providers, or give me a call and we go through the specifics of that and work out what options you've got, which might be better. Brilliant. Okay, thank you very much, everyone. As I said, this has been recorded and we'll email out the link later on. And if you've got any questions, feel free to give us a call. Thank you very much.